there, and welcome back to the Complicated Kids podcast. I'm your host, Gabrielle Nicolay, and today I am joined by Arielle Gates. Arielle, welcome.
Hi, thank you for having me.
You, as you and I know, are a speech language pathologist, but tell the good people a little bit about yourself, where you are, all those things.
Sure. So I'm a speech language pathologist. I have my own private practice called Stellar Speech Therapy in Alexandria, Virginia. And my practice right now is more focused on myofunctional therapy, feeding therapy, and speech sound disorders. And so that's kind of the area I'm most interested in. And I'm really passionate about sharing, all of these things that I kind of never knew in grad school, in terms of like airway, myofunctional therapy, and that's its role in speech as well. So
it's so good. So for those of you who are interested sort of in myofunctional therapy more broadly, there are a couple of episodes on that we'll link to. But today we're going to talk specifically about where articulation therapy and or articulation disorders, that means how kids are pronouncing things, interface or interact or crash right into myofunctional therapy, because you see a lot of this in your practice. Yes.
Yes.
And so who are these kids? Because we're going to talk about pediatrics for now. Who are these kids? What do they look like when they come to you? How are you thinking about, particularly, I think, in later elementary school kids? We can, we're mostly going to talk about those 10-year-olds who are still working on their R's. So they come to you with articulation and they have a history of articulation difficulties. What makes you put your myo hat on and be like, something doesn't smell right here?
Yeah. So, one thing is how long, if they've been in speech already, like if they've already been in speech, they've already been working on the sound and they're just still struggling, that's a big red flag, right? What else is going on? Like, why is this so difficult for them? That's one of my first things.
How long though? Like, kids work on sounds for a long time sometimes. Like, what's the test there? What's the measure?
I know. I don't know if there's necessarily a good answer, for how long. I would say if it's a kid, some of these kids have been in speech since they were in elementary, they were 5 years old, and they just kept going through speech. That's a long time, right?
Yeah.
And then, we have the other kids who are kind of like, yeah, they still can't really do their R's. And then they show up just for R and have never had any other issues before. So that's where I start, thinking, that's, interesting, right? And then we start looking at some other symptoms that they might have that their parents might not even realize are symptoms, right? So I have a ton of kids, or a few kids where I start asking about their sleep habits, asking about their feeding. Parents are, say, oh, they sleep great. Do they sleep with their mouth open? Yeah, they do. Oh, okay. So there's a difference between sleeping great and like optimal, right? What we should be doing. And I know you probably hear this all the time. I say this all the time. Like, just because something is common doesn't mean that it's normal, right? So kids who are 10 and still can't say R, that might be kind of common nowadays, but it's definitely not normal and it's definitely not what we want to see, right?
And it's not so much the myofunctional therapy, in case for the listeners, you'll have noticed there are lots of different podcasts on this. And in fact, there's a woman who has a podcast devoted entirely to this topic. It is a really diffuse set of symptoms that we're dealing with that don't appear related, and yet they are. And they cause slow, subtle, I want to say like nefarious changes over time that are really bad for our health. And so,
right.
Mouth breathing when you're sleeping is really, over time, terrible for you.
Yeah, terrible.
And, these are often kids who, I have one on my caseload. He's a late R kid. He's got a history of behavior disturbances, like he's a moody guy. Why is he moody? He's not getting enough air.
He's exhausted. Yeah.
Yep.
That's
Okay,
true.
so walk us through, because I know you have a couple of clients like this at least, where they're coming to you with a long rap sheet. What are the questions that you're asking yourself when they get to you? So sleep is one of them.
Sleep is one of them. Eating, how they eat is another, how they swallow, where their tongue sits in their mouth. That's a really good indicator. I ask all these older kids, if you're just sitting here right now talking to me, when you're not talking, like, where do you feel your tongue? Do you feel it on the bottom of your mouth, or do you feel it on the top of your mouth? Do you feel it touching your teeth? And it's almost always on the bottom, touching your teeth, right? And the optimal position is actually up in the mouth, not touching teeth. And so that's a good sign that they have some weakness in their tongue and it's not able to be in the correct position.
And then once you've sort of established, I mean, when they walk in and you've got a 10-year-old with an R, automatically the questions are popping, right? They're automatically asking these questions. How do you handle it? So they have this long history of speech therapy. You can see the red flags all around them, like nice little circle. What do you do next? Like, how do you communicate that to parents? Who do you get on board? How does that work?
Well, I think that's one of the more difficult things, I think, because the parents come in expecting articulation to fix the R, right? And we're here to say, well, actually, here's this whole other laundry list of problems we need to be concerned about. And that's something that I think is a lot for them to take in. It's a lot for us to relay, especially in like a short therapy session. So that's a balancing act for sure. And so I kind of like to open the door by saying, I think that there is some weakness, some inability to coordinate those oral motor movements to help to correctly produce the R, right? So I start there, opening it. And so I say, like, I would like to try kind of going back a step to these foundational skills so that hopefully when we do work on the speech, it will be easier and more effective. And most of the parents have been really open to that because they're kind of like, yeah, like this kid is 10 and he still is struggling. Like, let's do something different, right?
Yeah. It is a really interesting thing to think about. So when we're talking about, this is what I wanted to highlight earlier, when we're talking about articulation therapy, like traditional articulation therapy, what that means is the therapist, do something that I expect you, the child, to imitate. And then I give you feedback to get closer to the thing that I'm doing, right? And we'd have lots of different ways of making kids talk, right? And often what we see in kids for whom that's going to work, it works pretty quickly. And when I say pretty quickly, within a school year, we can make a lot of progress.
Right.
But it's often that R, and R is tricky. It requires a lot of different muscles and a specific position and all that. But there's often this like block, and then they cease to make progress, even like incremental progress, because there's this muscle piece. I find it fascinating. Tell me what you think about this, that like our profession in graduate school, we don't spend a ton of time on like muscle function.
No.
There's like one class.
Yeah. And it's very brief, like definitely not the focus for sure.
And mostly focused on stroke. Yeah. I mean, it's been a while since I was in grad school. You were there more recently than I was, but
a little bit. I mean, it feels like a blur, honestly, right? But yeah, it's more like medical based or right, like that kind of route.
And so sort of it's squishy, right? These developmental kinds of things that happen in kids where they have been born this way, and now we're getting these symptoms. And so I think it gets interesting when you start teasing apart, okay, what's this muscle doing? Okay, what's that muscle doing? Okay, how is that preventing a child from saying an R, for example?
Yeah, exactly.
What do you tell the kids? Because these are kids who are old enough to understand some of it.
Yeah, I mean, I kind of tell them, I think the same things I tell their parents, honestly. They're old enough to, kind of understand, and I think they really start to get it when we start doing some of these exercises and they're really hard, right? And so I say like, yeah, this is really hard for you, and that's a good sign that means like your muscles need more work on this to be able to do this correctly. And it's going to help you say your R. And because these kids know that their R is hard and they know it doesn't sound right. And so phrasing it like that, like this is going to help you with your R, has really been helpful, I think.
Have you ever taken somebody through a course of myofunctional therapy and there are resolved, or do they always need then more traditional articulation therapy?
I'm thinking.
I know I'm
I
thinking
do
too.
I have one kid who we did the myofunctional. No, I feel like I usually still have to do a little bit of articulation therapy because I don't know if you've experienced this, but I feel like a lot of times the R gets better, but it's still not quite perfect, right? And then you start going a little crazy and you're like, is that good? I don't know. Your brain starts to trick you.
Partially why I see very young kids. I have this weird mix of like pre-verbal kids and then like older 10, 13-year-olds with ours. But yeah, at some point you're like, I need a new listener. You have to go see someone else.
It's so true. It's hard. It gets hard.
Yeah.
And so I think there's usually some tweaking that they still need at the end.
But it goes faster.
Yeah, definitely faster for sure.
So much faster. Yeah, it's
So
super
much
interesting.
faster.
Okay,
Yeah.
talk to me about once you've got parents on board and kids on board, talk to me about like the constellation of professionals that you like to work with. I think this is something that it makes the whole field very complex. The field is very complex and the number of people involved can be very complex, and different people have different ways they like to do this. So who's on your team?
Oh man. Okay. Well, once we get parents on board, I usually like to just start with a little bit of just myofunctional therapy before we start branching out to other providers to see like what we can get from that. And then, so a lot of these kids also are having this open mouth posture, their mouth breathing. So if for some reason there's a physical reason why they can't breathe through their nose, then we send to the ENT. So that's one of our steps usually. These kids sometimes, I've had kids who have gone through the myo program, are still working on art, and it's just still not working. And then we start to look at, is there a tongue tie? Is there some other like mouth issue going on that we need to address? And so for that, I have some pediatric dentists who are specialized in ties, who can help on that.
So this is, I refer people all the time. I say, look for an airway focused or airway centered dentist. Is that what you say as well? What are the buzzwords people need to be looking for?
Yeah, so airway centric dentist is really good. If anyone has training from like the Breathe Institute, that's a really good sign. But I honestly like have not had the best luck just kind of referring out to I don't want parents to just kind of go out and find their own dentist. Like I refer to, people I work with who I know are have the same mindset, who are going to see what I'm seeing. And so I think it's always nice to be able to send them to a specific colleague rather than just branching out. But yes, airway centric is a big one. Holistic sometimes, or holistic, and then like Breathe Institute are things I look for. And there's also a bunch of databases you can look at for providers. So there's like Airway Circle. I don't know if you've heard of that one.
No.
Yeah. There's various people on there, like myofunctional therapists, dentists, ENTs, so you can kind of look on that.
Yeah.
That's the main one I've been using lately, but
Nice.
there's a few of them.
Okay.
Yeah.
Yeah. The point being, this is not the person who cleans your child's teeth.
No, right.
And while there are more and more dentists, and I actually have never heard of it. That's not true. There is an orthodontist that I know in DC who is I don't know if she's myofunctional trained or she has an interest, she's getting there, I don't know, but
Yeah.
very few orthodontists
Yeah, I
even
don't
think
really know
about this, as far as I can tell. So, but it's not every dentist, and it's certainly not most orthodontists at all.
No, yeah.
And not even most speech therapists, honestly.
I know, and it's so controversial still a little bit, which is a little bit sad, but um yeah, and I run into that problem a lot where parents are saying like, well, we asked the dentist and they said it's fine. And I'm like, well, I'm sure your dentist is great, but I would really love it for you, you know, if you would go see, just consult with this person. Like, you don't have to do the release, you don't have to do anything. Just go see, get it checked out, talk to them about it. It's always a good
ENTs
first.
too can be very dismissive depending on who you get. And ENTs and speech therapists don't have a great history. That I don't have any idea why that's
I know, I don't know.
ridiculous as far as I can tell. Because that's a pretty natural pairing, because hearing, ENTs are doing, they're dealing with hearing.
Right.
Anyway, and that's obviously a crucial component for good, clear speech. The place where I think, the ENTs can be, depending on who you get, are dismissive, is where, they're like, yeah, adenoids are enlarged, but they're not that big.
Right.
Right. Or yeah, kind of, but it's not affecting anything.
Right.
Meanwhile, this kid
But the kid's not sleeping and,
right, not sleeping, not eating well, is moody and having behavior issues, and also has an R.
Right. Well, and so the kid I'm thinking about specifically for this that we're kind of talking about was a similar kid. We started with myofunctional therapy. We did all the things, I started doing her R, and it just still, we were working for a long time and it just still wasn't getting better. And I said to parents, and I said, I really think we need to look at the tongue tie issue to see if that's playing a role. And they did. I sent them some dentists. They didn't go to any of the dentists I sent them. They went to an ENT, which I understand, the dentists usually don't take their insurance, so they want to go the insurance route, so they go to the ENT. I don't blame them at all. And the ENT had her stick out her tongue, did a few things and was like, no, her tongue is fine. She just needs a year or two of speech therapy. And I was like, a year or two of speech therapy? She's 10 and he can't say her R. It's crazy. It's you're not a speech therapist. You can't tell this kid how many years of speech she needs. I can't even tell them how many years of speech they need. I was just blown away. And so that's kind of what we're battling with too, because then the parents hear, oh, everything's fine. And you have to be like, well,
yeah. And
not.
then you're setting yourself up. And I don't know about you, I don't have a PhD. I mean, there are some speech therapists who do, but now we're dealing with a medical doctor, right? And there's all those authority issues there too, right? That are kind of baked into the system, where you don't really want to say they have no idea what they're talking about, but in this particular domain, they actually don't know very much about what they're talking about. And I'm saying that as somebody who knows a teeny bit more than them and not as much as you. So it's an interesting place to be. I always say I know enough to be dangerous, and to refer out.
For sure.
Okay, so constellation of folks. Anybody else? You mentioned dentists, and we got down a rabbit hole. ENT.
Oh yeah, sorry.
No, that's okay. Listen, you and me both. Who else? Anybody else?
Sometimes physical therapist or occupational therapist. A lot of these kids do really well with body work, so like cranial sacral therapy or chiropractor.
Mhm.
Um,
And this is another area. This is why I
yeah,
get so like blah about myofunctional, right? Because when you say body work to somebody,
yeah,
to most people, most people still don't know what that is,
I know. Yeah.
right?
It's very complicated. That's why myofunctional therapy is really hard because it's just all of this things that these people have never heard of, right? And
Mhm.
so it's really difficult.
Yeah. Yeah. And part of the reason, again, we've done on this podcast like multiple episodes on myofunctional is because it is so wide reaching. It is really complex. And so,
Um,
I so appreciate this is as as many rabbit holes as we have been on, this is actually a more focused version
right.
of what we've been talking about. As regards again, these like later elementary, tween mostly kids who are stuck in speech.
Mhm.
And the reason they're stuck in speech is not because there's a bad therapist, and it's not because the kid is doing anything wrong or not doing their homework, although the older they get, the less they do their homework, because guess what? It doesn't work.
Right. No,
um,
it's true.
yeah. But we need to be asking a different set of questions. And so these are the questions.
Yes, exactly. We need to be looking in other areas, like instead of just doing the same thing over and over and over, we need to start wondering, hey, what is going on here? Like look a little bit deeper
Mhm.
for sure.
Okay, so we're going to wrap up in a second. Tell us about a kid that I don't want to say fixed, that you really helped to cross this barrier.
So the kid who I was just talking about, um, she came to me with we did some myofunctional therapy. We are, but then she kind of hit the wall, right? Where she was working really hard and she was really trying, but it just wasn't getting any better, right? So, she ended up going to, after the ENT experience, they did go see another dentist, and that dentist ended up recommending the release, and so she ended up doing like the tongue tie release. We did myofunctional therapy before and after, and then now we're kind of still tweaking that R a little bit, but it's gotten so much better, so much easier for her to do the sound. She's less frustrated, and I feel like we're finally gaining some traction there. So she's not totally fixed yet, not totally done yet, but we're getting there. Which has been good to see. And I should say, like, it's really important to remember, like, if you start thinking about myofunctional therapy and or like tongue tie release, that doing just one of those things alone is not just going to be like the magic solution, right? Which is why you talked about the other providers, and it's a process and it's all helping along to the end goal, but doing just one thing is not just going to solve all the problems. But
And that's, that's because if you've got nothing else out of this podcast, it's because it's complicated.
right.
Right. And everything plays off of everything else. The way I move my mouth impacts
Right.
how it looks, but the way it's made also impacts how I'm able to move things. And so
Right.
and then, the older
Right.
I am, the more infused those patterns are, the harder they are
Yes,
to change.
exactly.
So Arielle, I so appreciate you coming on to talk about your
Thank you.
practice
It's
and your
really fun.
expertise. If people want to
Yeah.
learn more about you, how do they do that?
My website is Stellar SLP. So Stellar like stars, STELLAR SLP .com. You can find me there. I'm on Instagram, Facebook, all the places. And I've also been doing kind of my own airway myofunctional journey. And so I've been sharing a lot about that on social media. So if anyone is interested, go check that out. And I love talking about this stuff. So I'm happy to chat with anyone who thinks they might have some similar issues.
Yeah, not just for kids.
Not just for kids. Yes, not just for kids.
Yep.
Babies all the way through adults. Yep.
Although fair disclosure, the earlier you do it, the better it is.
The better, for sure.
All
For
right,
sure.
Arielle, thank you so much for being here.
Thank you.